Welcome to the legs lecture for the digital figure sculpture course. So this week we're going to review the musculature of the legs and talk a bit about the bony structure of the knee and send you guys on your way to get on with your sculpting work for this week, which is going to be, no surprise, legs. We're going to have one straight leg, we're going to have one bent leg, and then you guys are going to have to do a little bit of work on the structure of the knee. Okay, so I want to give you guys a kind of a broad refresher of the critical things to do with the musculature of the leg. I'm not going to go in depth, like anatomy course in depth, but I'm going to mention all the things that are important to this week's exercises because we're going to see a lot of these forms on our model this week who happens to be a ballet dancer, right? So he has very developed quadricep muscles, but surprisingly not actually that defined. So we're going to be talking mostly about broad volumes and shapes rather than specific definition. Okay, so the first thing for me always is find the anterior superior iliac spine, the ASIS. Okay, from here, my favorite little muscle of the leg, it has to be the sartorius, and it comes down in a very nice, graceful gesture all the way to the inside of the knee, right? So to the medial surface of the tibia, right? And this guy gives us our inner boundary for the big important muscles of the legs, the quadriceps, right? Quadriceps is, again, four heads, but there's three main ones that we're looking at. Okay, the big one, well, the first of the three, anyways, is vastus medialis, which is this guy. And he's going to be teardrop shaped, remember, and he borders right up against the sartorius. Okay, his neighbor is rectus femoris. Rectus femoris means straight up and down the femur, rectus femoris. Straight up and down the axis of the femur, like this. It's kind of wedge-shaped or arrow-shaped, shooting directly down towards the patella. Okay, adjacent to him, to the outside, is the big muscle of the quadriceps vastus lateralis, which would translate to big lateral muscle. Okay, it doesn't take a degree in rocket science. Okay, so vastus lateralis here, not too big, but go around to the outside, the lateral view, and you see the full power of vastus lateralis. And remember, this guy comes all the way up and kind of right up to this nice bony landmark of the femur, the greater trochanter, right? So this sits right underneath the greater trochanter and comes down. Now, the thing that I've always talked about in relation to quadricep muscles, and this goes back to anatomy study, the thing about the quadricep muscles is not so much their individual distinctions, but how they insert into the patella via their common tendon, right? So vastus medialis grabs on directly down onto, pretty much onto the patella. So this diamond, little triangle-shaped bone is the patella. Vastus medialis fibers come down and pretty much touch it, okay? As you ascend from that, along the lateral border of the vastus medialis, you come up to the apex, right where you switch off, and the rectus femoris gets a little parcel of tendon that it passes straight down. Okay, from there we go on a nice broad diagonal down into the outside, but not all the way down to the patella. Right, we still have this space here between the edge of the vastus medialis and the patella. Right, so it stands off from the patella a good ways. Right, and this little piece of tendon is the magic construction I want you guys to pay attention to this week because it's going to be very important. And it does. It shows up quite prominently on our guy, as you would expect. He has a quadriceps tendon. Okay, from there, the quadriceps tendon focuses through the patella and passes the force down to the patellar ligament, and that grabs onto what's called the tibial tuberosity, which is just an anchor point on the bone for this very, very strong pull of the quadriceps. Okay, so in general, depending on what we see this week, this is going to be a big, broad mass. We're going to have the border with the sartorius going through here, and that sets up a plane change to these muscles that we see to the inside, which is collectively called adductors. And you can see a lot of individual separation in this plate, but in reality, in life, it's quite different because these are very broad, round mass with no distinction. Okay, so that's how we're going to treat it. Okay, now let's just pop around to the lateral aspect. And what we have is the other of the two muscles coming off the ASIS. Okay, and this is something called the tensor fasciae latae. Okay, and this is just a little bit of fibrous muscle that comes down and doesn't grab onto anything in particular, meaning it doesn't pass its tendon down to bone, but it grabs onto something called the iliotibial band, or the fascia lata. And this is just a really thickened portion of this fibrous stocking, this fascia that covers the entire body and especially the legs, right? And in this area, it gets really thick and tendinous. And so, hey, the tensor fasciae latae says, why don't I use that as a tendon? So it grabs onto it and it pulls from its anchor point on the hips, the iliac crest, down, and it exerts force on the side of the tibia. Okay, enough about that. Adjacent to the tensor fasciae latae is our friend, the gluteal muscles, right? Gluteal muscles are a big spiral or a big kind of cashew nut of muscle that sit in the iliac crest all the way along its crest and then down to the sacrum in the back. And pretty much they spiral around the greater trochanter and articulate it, right? So they pull in all these directions for the first 2/3 of the muscle. These are little arrowheads that I'm putting on here, by the way. First 2/3 of the muscle. And then the last third of the muscle is not grabbing onto the greater trochanter, but actually comes down and goes deep to the vastus lateralis, grabbing onto the femur. So it goes way in there. And then some superficial fibers grab onto the fascia lata, or what we also call the iliotibial band, right? And we'll see this form in our reference this week, so pay attention for it. Now, moving posterior to all these masses that we've talked about, we get into this magic muscle called biceps femoris. Right? Biceps femoris inserts into the head of the fibula, this beautiful little bony point in the lower leg, right? Fibula is the accessory bone of the lower leg, the little spindle that sits alongside the tibia. Okay, so the beautiful thing about biceps femoris is that it passes this perfectly straight tendon down on a standing leg. And this helps to orient your bodies of both the vastus lateralis in front and then the body of the actual biceps femoris itself behind, right? It sets up this plane change right back here. Okay, so find this angle on the reference that you see this week, and just be aware that in somebody who's developed this short head right here actually makes this all nice and broadly convex. Okay, and we'll see that this week. Now, that's going to lead us into the lower legs, and quickly, because we cut our guy off right about here this week, what we're looking at is the shin muscles that slot into the little depression behind the tibial crest, right? So we have this plateau of the tibia, and we have a collection of muscles that slot in right underneath into the rear of that. The biggest one is tibialis anterior, which we really like. Beautiful muscle, and we'll see it nicely broad and convex right in here. Next to him, we won't worry about extensor digitorum longus right now, but we'll talk about the next one, which comes immediately off the bottom of the head of the fibula, and this is peroneus longus. I'll change colors just to be clear on this. So peroneus longus in cyan is coming straight down, and we won't see his body individually, except maybe in one instance this week, but just be aware that he aligns himself perfectly with the head of the fibula, and then also the tendon of the biceps femoris on a standing leg. Okay, posterior to that should be a review for you. We have, and I won't pick green again because I've just done green. We'll go magenta. Soleus, which is one of the extenders of the foot. And then posterior to that, we have gastrocnemius. Gastrocnemius is the nice case, the special case of these muscles, in that it doesn't insert on the lower leg. It actually, or doesn't originate on the lower leg, that is. It originates up behind and in between the hamstring muscles on the back of the femur, specifically on back of the condyles of the femur. So if we have the femur going up here like this, up to the greater trochanter, something like that, into the socket, gastrocnemius goes up, grabs onto the back of this, right? That's how it works. Now, when I say grabs onto the back, I'm talking about it going up and wedging between the biceps femoris tendon on the outside. So this tendon is going to go out here and down. And then on the inside, we have other hamstring tendons. If you remember, and this should be a refresher for you, semimembranosus and semitendinosus, two tendons are going to come along the inside right next to each other. And those are going to interlock with the gastrocnemius, the heads of the gastrocnemius. Okay? As far as hamstrings go, hamstring muscles, we're going to treat them as a unified mass this week. We don't see any individual separation. So just unify them and keep them round and broadly convex. We'll look at the gluteal muscles in a minute specifically, but we're going to have forms in here as well. Okay, quickly looking at the inside of the leg, we've already looked at sartorius coming down, and this is just a beautiful little gesture, the way it grabs onto that inner surface, that inner kind of downward facing plane of the tibia. You get a chance to sculpt that this week, so you become intimately familiar with what I'm talking about. But what you get as this kind of comes into this nice gesture is you get a very strong plane change with the large round outer head, lateral head of the gastrocnemius. So you get this nice border coming through here. Okay, remember up here we have kind of the broad convexity of the hamstring, and then adjacent to that we have the broad convexity of the adductor muscles in here. Right, so as you'll see, looking forward, this week is going to be all about getting the volumes right and getting these big, broad shapes correct, rather than going in with kind of fine details and striated muscle like we've seen in past weeks. Okay, so just a quick triptych of images. A cutaway of the quadriceps showing how the rectus femoris, this guy, dives into the anterior inferior iliac spine, right? He goes inside the body right here. And as a result, his diving in creates a nice flat surface up here, right? And this actually ends up being where the bend in the leg happens when you flex at the hip, okay? And it's approximately right here on him. And we'll see that in our leg that flexes at the hip this week, okay? So just keep that in mind. Other things, Sartorius is going to set up a broad plane change, not going to create individual definition itself. You'll see as I work, though, in this week's working example, a lot of times I will go in and sculpt these shapes that I know are setting up the big planes, setting up the big volumes. So I'll go in and I'll define these with some clay tubes and later unify them. But keeping them distinct and individual, for me anyways, is a good way to set up kind of the subtler plane changes that sometimes you can't observe directly from a single piece of reference, right? But there will be plane changes here, although we can't see them, right? And it's a fine balance between sculpting what you see and sculpting what you know. I say that all the time, but it's important to hit the right balance. And as you know more, you can start to bias that trade-off towards sculpting what you know, and then just with a slight modification to what you see. Okay, so look at those big quadriceps. Other interesting stuff is this nice little gesture that I was just talking about. And also, look at the quadriceps tendon. This is exactly what I described on an earlier slide. Patella sitting right in here, embedded in fat. Look at this. I'm going to change to fat color. Yellow, please. Big fatty pad sitting under the patella on a standing leg. On a bent leg, that slides into the space set up underneath the condyles of the femur. Okay, and then this is the patellar ligament. Okay, enough of that one. Quickly looking at the gluteal muscles. This is the greater trochanter. Remember that behind it is all this tendon, right? And tendon doesn't flex and expand, right? So all the convexity that we see in gluteal muscles happens posterior to this tendinous bit. And that's what we see here. Greater trochanter, tendinous bit, and then the bulge of the gluteal muscles. Okay, and then we see a little bit of the bottom extension of the gluteus maximus coming down right here. Okay, look at that angle of the biceps tendon, biceps femoris tendon coming down to the head of the fibula. Love it. Now, just a quick look over some of the critical features that are going to be important to attend to in this week's exercises. 1, construction of the common tendon, right? I've said it maybe 5 times already. Pay attention to it. 2, you have to do some investigation into the masses that create the shape of the knee, right? I've told you that it's bone at the top with patellar, with the quadriceps tendon embedding into it at the top, bone, and then fat at the bottom, and then ligament coming off that, and cover all of that in skin, and you have a recipe for disaster, right? So takes very special attention to sculpt the knee well because of all those different factors. Okay, look at this little, look at that little transition there. We have to attend to this. Other things, let's see, there's going to be the plane change here. Look at the round massive adductors. Moving to the next view, you can see that the vastus medialis is not a huge round teardrop, but it's still there. The teardrop is still there. So find a way to describe it and then subdue it. I think that should be a decent strategy. Look at the convexity of the rectus femoris, right? So this guy has big quadricep muscles. Interesting, this guy was a ballet dancer, and he ruptured his Achilles tendon, right? So you can see some really, really bad stuff happening down there where he had surgery. And it might be because of the fact that his Achilles tendon was ruptured that his calf muscles are a little bit smaller than his quadricep muscles. He was on 9 months of rehab when he came into the studio to shoot this reference. Okay, so moving to the next view. In this rear view, I want you guys to just attend to the interlock of forms between the lower leg and the upper leg, right? So get this nice round mass of the adductor tendons and the semimembranosus, semitendinosus tendons, this round mass of kind of unified hamstring bodies, and then this interlock of biceps femoris to the outside. Also attend to these planes set up by fat up here on the gluteal muscles. And back to the outside. Just look for these shapes. Look for the tendon on the outside. Look for this, the tendon of the biceps femoris. Then look for the big round convexity that it sets up. This guy is quite developed in the hamstrings as well. Okay. I said that we don't see too much individual distinction in the lower leg, and that's mostly true, but you do see this nice convexity of tibialis anterior. It's going to slot in right here on the tibia. Okay, now the next bit of this iteration is to bend the leg and start to analyze the forms that are created. And primarily, when you bend the leg, what happens? Well, it's like articulating any limb of the body. Something that's flexing it shortens and gets bigger, and whatever extends it lengthens and gets thinner, right? So the convexity up here has reduced, and the convexity down here has increased. The routing of the tendon of the biceps femoris has changed. It's not shooting directly up, it's shooting backwards. And other things that are new and different are the condyles of the femur really start to expose themselves on the bent knee, right? And this takes a little bit of learning and exploration to really internalize. But part of the exercise this week is to really sculpt the end of the femur and the patella and the tibia and really get a sense of those bony volumes. Okay, so we're going to look at this very carefully. Quadriceps tendon. It's going to be a little pop. This guy's quite shiny, so don't confuse the shine with muscle boundaries. Little pop in the rectus femoris. This is the best I could do for the inside of the leg in this particular pose, but I want you guys just to know soft and fleshy, right? All these muscles are just kind of coming together in their tendons, sartorius, remember, and all the adductor tendons, and create a big fleshy body, okay? So it really is quite fleshy. Now, to extend this kind of one step further beyond just the surfaces of the leg, what we're going to start to look at is the bony surfaces of the knee. And this is what we start to see, like I said, when we bend the knee, is we start to see these surfaces exposed on the lateral view of the knee, right? We start to see really bony areas of this condyle of the femur. Okay, so that's why I have this plate up here. You guys could do a lot worse than spending an hour or two copying these constructions. It's from a guy named Gottfried Bams, B-A-M-M-E-S. ES. People who've been on my anatomy course are familiar with him. Essentially, he gives you the breakdown of how the knee works, and the knee works like a rolling pin. And so the condyles, the rolling pins, sit there on the tibial plateau right here, and they roll back and forth. And so surprisingly, or maybe not so surprisingly, when the knee rotates and the knee flexes, the femur rolls back, but it's not just rotating, it's rolling. So in fact, the center of this condyle actually translates backwards as the knee goes further and further back. Okay, so what you get is you start to get a very distinct change in planes between a standing leg and a bent leg at the knee. Okay, the other thing to add to the complexity is the fact that on the standing leg, the patella is popped out front like this. It sits on this flat bit of the femur. On the bent leg, there's a little slot in between the condyles that opens up, and the patella just kind of wedges in there. In fact, the patella on the back side has a little groove going down it. This is going to be horrible. A little groove going down it that helps it to sit in the condyles. It just kind of routes it and helps it slide in and out without binding. Okay, so guess what? You guys are going to get to sculpt something like this, time permitting. Okay, and so that's it. This is kind of where we're going this week. A standing leg from Z-spheres. The progression looks like this. Z-spheres to sculpted leg. Paying attention to some of the things that I've talked about. From sculpted leg, transpose to bent leg. And there's some interesting lectures on transposing this somehow, or a few technical things to help us kind of maintain consistency in our landmarks. Okay, from here, we have some fun. Again, time permitting, cut off this guy with Dynamesh and actually take this actual segment from the knee and Dynamesh it and slice curve and do all sorts of clip curve to sculpt out this knee, which is actually all the pieces. So end up separating this with the slice curve into the femur, patella, tibia, and fibula. So that's a lot of fun, and it's really fun to just go and play. And time permitting, from there, you take this and you transpose it back to a straight leg, right? Then slide the patella back up and align the condyles on top of the tibial plateau. Okay, so that's where we're headed this week, and I go through all of this in the working example so you guys can see how I've gotten about this result. Okay, good luck to you, and we'll see how you do next week.